Bismillahirrahmanirrahim. The functions of male sex hormones, especially the testosterone, is discussed in this video. The testosterone starts functioning during the development of the fetus. Its secretion begins around the 7th week of embryonic life. The male sex chromosome that contains the Y chromosome. It contains the sex determining region gene or sex determined region Y gene that is located on chromosome Y, and it encodes the testes determining factor or SRY protein. This protein initiates a genetic cascade that lead to testosterone production by the developing testes. The SRY protein causes differentiation of genital rich cell into testosterone secreting cells. These cells form the testes. In the absence of SRY protein, when this protein is absent, the X chromosome in the genital rich cell, they secrete estrogen that lead to the formation of ovaries or female differentiation. So SRY gene or this SRY protein is the on switch for male development, and testosterone is the chemical signal that sculpts male organ in the fetus. There is a role of testosterone during fetal development. In experimental evidence, there is evidence that whenever the increased quantities of testosterone are induced in female fetus, it leads to development of male sexual organs in the fetus. And in the male fetus, if the testes are removed, there is development of female organs. So this testes has got a key function. This testosterone, it has got a key function. It promotes male organ development such as external genitalia, penis and scrotum instead of clitoris and vagina, and internal structures, the prostate gland, seminal vesicle, and male genital duct such as vas deferens. It also suppresses female organ formation uh, by indirectly inhibiting the development of female reproductive tract. So its source is genital ridge. Later, the source is fetal testes. So the architect of the male body in the womb is testosterone that design the male structure while tearing up the blueprints for the female development. Testosterone also causes the descent of the testes in the fetus. Uh, During the last 2 to 3 months of the gestation, this process is triggered by increasing secretion of testosterone from the fetal testes, and testes descend from the abdomen through the inguinal canal into the scrotum. So if testes remain undescended but anatomically normal, administration of the testosterone often promotes the descent. Gonadotropic hormone, which stimulates Leydig cell to produce testosterone, also helps to induce descent. Testosterone is a key hormonal signal for testosterone descent, and its presence confirms the role of androgen in male genital development during fetal life. Testosterone can cause massive enlargement of penis, scrotum, and testes, and this enlargement occur up to eightfold between puberty and age of 20 years. The secondary sexual characteristics are also dependent on the concentration of the testosterone. Increased hair distribution or growth in the pubic area, linea alba, the abdominal midline up to or beyond the umbilicus, face, development of beard, chest, back and limb, and the existing body hairs may become thicker and more abundant. Main pattern baldness occurs because the testosterone suppresses hair growth on the scalp's crown and it requires the genetic predisposition and high level of androgen. So men without testes do not go bald, and women with androgen producing tumor and genetic predisposition may also develop male pattern baldness. There is a deepening of the voice also due to testosterone because laryngeal mucosa hypertrophies and the atom sepal or larynx is enlarged. It results in deep adult male voice, initially causes voice cracking during puberty due to transitional changes. So testosterone can also increase the thickness of the skin and contribute to development of acne. Testosterone increases or causes the entire skin layer to become thicker and tougher. The subcutaneous tissue also become more rugged and it is more fibrous. So this contributes to the masculine texture of the male skin. Then this testosterone also stimulates the secretion of the sebaceous gland. So sebum is produced and causes, in this especially in the facial sebaceous gland, this increased sebum will result in acne, particularly in male adolescents. Then acne is a common uh, common condition that occurs during teenage years due to the surge in this testosterone. Over time, the skin adopts and acne typically decreases in severity. Testosterone also causes the increase in protein formation and development of the muscle. So the testosterone causes a 50% increase in muscle mass compared to the female. This occurs after puberty, making it a key male secondary sexual characteristic and also responsible for protein anabolism. It stimulates protein synthesis in muscle tissue and also in non-muscle tissue such as skin and larynx and result in thicker skin, deeper voice as we have seen earlier, and in athletes sometimes they use synthetic androgen to boost their performance, and it is risky and discouraged due to harmful long-term sequences. So elderly use androgen as a youth hormone to improve the muscle strength and vigor, and but the effects are inconsistent or marginal. Testosterone also increases bone matrix and causes calcium retention. See, the bone thickness, deposition of calcium salt, both are increased, and it is driven by protein anabolic effect and calcium deposit that follow increased bone matrix production that result in thicker bone. Then there are some pelvis specific changes. Under the testosterone, there is development of male pelvis that narrows the pelvic outlet and lengthens the pelvic outlet, and this become funnel shaped, that is ovoid in female, and this funnel shape gains increase strength for load bearing. So sometimes the testosterone is prescribed to older men for treating osteoporosis due to its bone strengthening effect, and effect in growing children. This excess testosterone that is natural or injected causes growth spurts in height, but also early closure of the epiphyseal plates, so that result in stunted final height despite early rapid growth. So castration before the puberty may lead to slightly taller height, adult height, due to prolonged growth period. Testosterone is also responsible for increase in BMR. There is protein anabolism, and the increased quantity of the proteins along with enzymes are formed. So the metabolic rate is increased. It is raised uh, by 15%. Normal testosterone level during adolescence or adulthood will result in increased BMR by 5 to 10%, and mechanism is likely indirect via increased catabolic anabolic action of the protein. There is we have seen that these enzymes are produced in greater number, greater amount, so more active cellular processes across the tissue are there. So these high energy expenditure event at rest, they enhance metabolic activity across organ system. So testosterone also is responsible for increased RBC count. It increases RBC by 15 to 20% when given to castrated adult. Men have about 700,000 more RBCs per cubic millimeter than women on average. The mechanism is indirect. Testosterone doesn't directly raise the erythropoietin. It like it likely boosts RBC indirectly through increased basal metabolic rate and increased tissue oxygen demand that result in secondary stimulus for RBCs production. There is effect of testosterone on electrolyte and the water balance also. There is a mild mineral corticoid like effect or activity of this testosterone that increases sodium reabsorption in the kidney distal tubule, but this reabsorption is not as much potent as aldosterone, that is the primary mineral corticoid. And also there is increased blood and extracellular fluid volume, because this causes this testosterone causes 5 to 10% increase in blood volume and extracellular fluid due to sodium and water retention. These fluid retention effect may contribute to slight rise in blood pressure, overall male fluid balance differences versus female. So here this is the summary chart of the major physiological effect of testosterone. There is development of adult primary and secondary sexual characteristic. There is another function, that is increased thickness of the skin, that contributes to the development of acne, increased protein formation and muscle development, increased bone matrix and calcium retention, then increased RBCs and increased basal metabolic rate, and also it influences the fluid and electrolyte balance by the slight mineral corticoid activity. Thank you for watching this video. If you have any query, please write in the comment box.